Hello there, 6 North. I'm James from the leadership team, and today I'll be discussing a few items such as 6 North's patient experience, a picture-perfect patient interaction, human clinical human model, and operational priorities from the nursing perspective versus the patient perspective. Here we have our own night shift nurse Steve representing the patient. As you can see, many departments influence his experiences and perception of Sharp. This highlights a typical surgical patient stay here. They choose the hospital, find parking, head to the reception desk, then is escorted to the surgical procedural area, also known as spa, have a successful surgery, brought to the room, then finally hit our unit and are welcomed by our wonderful staff at the front desk, and arrive in their room greeted by our excellent nurses and nursing aides. The next morning, the vampires, lab, wake them up at 4 o'clock in the morning. Doctors round throughout the day. Then finally, they see the elevator and they exit our building, thus leaving the 6 North experience. But let's break this down and determine how we can focus and provide very good care when they hit our unit. Recognizing the patient when they arrive to our unit by saying, "Welcome to 6 North." Acknowledging the patient by the preferred name as they walk throughout our hallway. As for rooms, we have to maintain it and keep it clean and uncluttered. Finally, nurse and nursing aides can bring the human back to patient care. By human, I mean this. This is a picture of security guards at Disney. They are role modeling what to do when a guest has a question, such as, "Where can I get ice cream?" Her name tag has her name, location, and position. This is important as it can bring up personal discussion. For example, "Your name is Jamie? So is mine. And you're from San Diego? I am too." She is pointing with 2 fingers to tell the direction. She has a radio to contact help. She provided eye contact and is smiling to illustrate kindness. Now here's how it looks like in the patient setting. Sam introduced herself and is close to the patient. She is maintaining eye contact while they're discussing the plan of care for the day. Sam is wearing her name tag to showcase who she is and what her role is. And lastly, carries a cell phone so patients and team members can contact her. This interaction is very similar to what Sharp uses, named Aid It. Acknowledge, introduce, duration, explanation, and thank you. This model demonstrates how to conduct any interaction with patients by starting with a personal or human action, then conducting your clinical task, and ending or exiting on the interaction with another human touch, such as "Have a nice day." The clinical parts of the model are interchangeable based on the kind of interaction or job task. However, this model should be used by clinical and non-clinical staff alike, and applied universally to patients, visitors, and fellow employees. This model should be implemented whether face-to-face, sending an email, or making a phone call. In other words, you enter the patient's room, introduce yourself, this is the human interaction, say, "Hi, how are you? I'm Sam, and I'll be caring for you today." I've seen Liz introduce herself with a handshake as well. Then, you explain what you will be doing. This is the clinical interaction. "I'm going to listen to your lungs, your heart, and stomach, and look at your surgical incision." Or, "I'm here to take your vital signs." Finally, leave on the human interaction. "I'm leaving now. Do you have any questions? Or is there anything else I can do for you?" Next, we're moving to operational priorities. How do you deal with conflicting or competing priorities? How do you handle delay dilemmas? Culturally, what priorities do we put first, second, third, and fourth? What do we discuss most, measure most, reward most? Between efficiency, safety, quality, competency, and compassion. Culturally, 6 North may view it with efficiency first, competency second, safety, quality third, and compassion last. So let's look how the patient views it. Patients rank safety, quality first, compassion second, competency third, and efficiency last. When we place the lists side by side, they differ quite a bit. With that knowledge, you must listen to the voice of the customer and give them what they want in the order they want: safety, quality, compassion, competency, and efficiency. This can be illustrated by our own guardian angels. I asked a few guardian angel recipients what they thought got them the guardian angel, and here are some of their responses. I spoke to them about their personal life outside of the hospital. I showed interest in what they chose to talk about, created a conversation. I walked with my patient. I told them they deserved my time. I developed a plan of care with my patient surrounding what they feel their priorities are, such as pain. Provided teachback to verify teaching was effective. And finally, I genuinely cared for my patients. All of these characteristics show the human care that is given to the patient and is what the patient wants. So enter on the human, explain the clinical, and exit on the human, thus bringing the human element back to nursing.